Human baby cannot talk, cannot walk, cannot do anything basically. All baby can do is cry and poop and sleep. So the baby's brain at the time of birth is around 25% of adult size. And then it reaches to 90% of adult size by 5 years of age. And during this time, millions and billions of neuronal connections are going to make. In order to be successful in life, basically, we need to learn how to work while staying relaxed. Only then you're gonna move forward. Because if you
Mm,
try to do something while you're stressed, all your effort will convert into heat. The outcome will be zero.
yeah.
So
Yeah, that reminds me of a joke. You may have heard about it when they said, does obesity run in your family? I said, no one runs in our family.
then you are a mother. We doctors may be the specialist of our field, but you are the specialist of your child. You dad, you are the specialist of your baby. If
Mm,
you feel that your child is lacking something, don't ignore it. Speak
mm,
up, talk to your doctor. Failure is
mm,
very important in life because if you won't fail, how would you analyze what mistake I did? And then you will retry, and then you will fail again, then you will retry, then you will fail again, and then you will realize, oh, fine.
Hello and welcome everyone to our very special episode of the Homeostasis Podcast. My guest today is an expert, board certified neurologist, as well as pediatric epilepsy specialist, a very good friend of mine, a classmate from medical school, one of the smartest and the brightest kids in the class. He is a pediatrician and pediatric neurologist who trained at University at Buffalo in Buffalo, New York, and then he went on to specialize in pediatric epilepsy, EEG, electrophysiology from Cleveland Clinic, Ohio, which is one of the top institutions in the country in this field. And he spent 2 years learning how to read the EEGs, how to diagnose the complex seizure disorders, and the neurophysiology of the kid's brain. He is a brain doctor. He is a very smart doctor. Right now, he is serving as associate professor of pediatric neurology and epilepsy at University of Toledo, Ohio. He is training medical students, residents, fellows in this specialty. He has published extensively, at least 20 papers that I could see, with hundreds of citations for each paper that he has published in the area of kids' brain development, neurology, and epilepsy. Tons of poster presentations. He's also a member of board of directors of the Epilepsy Board in Ohio. Correct me, Dr. Mahfooz, if I'm wrong. And he is overall a very good guy. So he was always an inspiration in medical school for the fellows, for the juniors, and he was always one step ahead of his class. He came to Cleveland Clinic, Ohio, when he was in the final year of medical school. And since then, he's been visiting that hospital off and on, helping them out, taking care of EEGs and taking care of patients with epilepsy. Thank you very much, Dr. Mahfouz, for joining us. I know it's late at night, 8:30 p.m. where I am, and you've been working all day, and I'm pretty sure you are still on call. So thank you very much for joining us today, and thank you for sharing your knowledge and your experience with us.
Thank you very much, Ahmed, for this very kind and elaborate introduction. And I'm very happy to be in your podcast. And this is a very good initiative you have made. I've seen your previous podcast with a few of our other classmates, and I really appreciate this effort.
No, thank you very much. All we are trying to do, because you see on the internet all over people giving advice, people who are not qualified. So we are trying to get the board certified specialists in their areas of expertise who have years of experience, who have learned about the subjects, who have done research, who are qualified. And then they're not trying to sell someone something. They are giving their unbiased, unsponsored opinion just purely based on the evidence as well as the experience. So that's the goal of our podcast. Our target audience is general public. We want to educate them so they can take ownership of their own health and the health of their kids and health of the people around them. And people like you are a blessing to the society, and I'm glad you're here to share your experiences with us. So tell us more about yourself. What are you doing these days? What type of patients you are seeing? And what are you doing in life generally?
In my life, I have several responsibilities and priorities. One of the major priorities is my family, three beautiful kids and my wife. I am taking care of a number of patients in Toledo, Ohio. I usually do pediatric neurology, but my major subspecialty is epilepsy. Around 45% patients are pediatric neurology and 55% are epilepsy.
I see. So you are mainly dealing with kids who are at the complicated side of the neurology practice. Like epilepsy is, from my
Yes,
understanding, one of the hardest things to diagnose and treat when it comes to the kids' problems growing up. Is that right?
that's correct.
That's correct. So, what got you interested in pediatric neurology and epilepsy in particular?
Actually, what happened when I first came to US, I was doing research in multiple sclerosis. So then a family incident happened. One of my cousin's son, he was 3 months of age, and then when he developed epilepsy, and
Mm.
we could not find even a single pediatric epileptologist in Islamabad. Islamabad is the capital of Pakistan, and that's the city with very good resources.
Oh,
And
yeah.
even in that city, when we were not able to find anything, my cousin used to call me, he used to ask me questions. And inside my heart, I used to feel so empty. During our medical school, we hardly had any exposure to pediatric neurology. And then those days, there were a number of factors. So one of the pediatric neurology professors, who was also a book writer, his name is Dr. Michael Cohen. Somehow I came in his good books, and then this incident happened. So one day he told me, like, why don't you join pediatric neurology? And then I asked, what is this field and what can we do? And then when he explained, so it was aligning with my new aim of treating my cousin's son. So the other thing happened, I was also reading the book The Alchemist. It's a
Yeah.
book by
Paulo
Paulo
Coelho.
Coelho.
Yeah.
And that book was, the message in that book was like, you have to follow the omens and the signs. The nature, the
Yeah.
universe is alive, it's a living thing, and this universe talked to us, and then it opened gates for you. And also the third factor, I was listening a lot, like one of the Junaid Jamshed songs. So why? So it was all about what to do in your life. It was like the message of the song was that do something which no one else is doing. Why should I adopt a path in which on which everybody is walking?
क्यों चले
Yeah,
इस
yeah, that
राह पर
one.
जिस
So
राह पर सभी चले.
yes. So then I thought, I think I should do something which is different. This is the path. And I was
Mm.
looking all around my peers, like our medical school groups, our
Yeah.
classmates, they were really smart. And you were among one of them. And then I was just thinking, who among us 10 years from now, 20 years from now, who will be the pediatric epilepsy and neurologist? Who isn't? But there was nobody. There was a trend towards internal medicine, there was trend towards cardiology, very popular. So then I decided maybe this is the natural calling for me and jump into it.
That's definitely inspirational. And I'm glad you are a pediatric neurologist because anytime one of my kids is not walking right or talking, I always call you and send you something and send
Yeah,
a video or a picture, and you are always very helpful. So we are glad you are doing what you are doing, and thanks for doing it for everyone.
thank
So let's jump into our topic today. We have a lot of questions for you. Our first session is going to focus on general neurology questions that parents have regarding their kids about the brain development and the things that can help, things that can hurt, how the kid is growing, is he doing something right, is he doing something wrong. And then our second session will focus on your area of expertise, which is the epilepsy, in simple words, seizures in kids, because it is something that can be easily missed. And even if it's diagnosed, sometimes people are not able to get the right treatment, like you said, even in cities like Islamabad, where they have all kinds of specialties. So let's dive right in. My first question to you is, what's happening inside a baby's brain in the first 5 years that makes these years so important?
so a human baby come into this world, compared to other the babies of the other animals, we are still very premature. Human baby cannot talk, cannot walk, cannot do anything basically. All baby can do is cry and poop and sleep. Three things. So what happens in the first 5 years, if I use a single word, is construction. So in the first 5 years, if you can imagine what happens in the brain, you imagine two places. One is a house which is already been formed, and one a house which is under construction. So if you make a video of it and just fast forward it, you will see a house which is like your house, my house. When does the moment happen? When you leave the house, when you come the house, at night time you turn the lights on, during the day you turn the lights off. That's the kind of picture you get. But a house under construction, you will see a lot of workers and machines, and they are running around and they are moving things. There's a lot of supply, and then a lot is happening. So same is the case with the baby brain at the time of birth. So the baby's brain at the time of birth is around 25% of adult size, and then it reaches to 90% of adult size by 5 year of age. And during this time, millions millions and billions of neuronal connections are going to make. The child has to learn everything. He has to learn how to look, how to hear, how to develop. But child has to develop language. Child has to learn how to walk and how to develop communication, and that is going to happen by millions of neuronal connections. So each faculty which the child develops, basically there are multiple neurons who gonna join each other. They're gonna make a synapse with each other. And then the other thing which happens is our brain has two major substances. One is the gray matter, which is basically a neuronal cell bodies, and then we have the white matter. So the matter, you can imagine it is as if you imagine a spider which jumps from one place to another place. What does a spider do? It leaves a thread. Similarly, the way our brain is formed, right next to the two lakes we have in our brain, we call them ventricles. So there are neuronal stem cells or the neurons. Then they move from that place to the periphery, and then they leave a thread like a spider thread, and that thread is initially not myelinated. It means it's like a wire without an insulation on it. And then there is a whole bunch of a process, we call it myelination, in which those fibers get insulated by a lot of lipids, we call
Mm,
them, and that process is basically myelin sheath is formed.
mm.
So that process also plays a critical role in why the child starts achieving milestones at a certain age. This process is very much involved, very important to understand. And probably you have seen that when you look at the MRI of an adult
Mm.
compared to MRI of a baby, your mind take a spin, because all the parameters, in order to read the MRI of an adult, there are specific lines for white matter. So T1 has a
Yeah.
specific finding, T2 has specific findings. Those parameters totally change in the baby because
Mm.
of this myelination thing. And then this initial 5 years period is the area where the child is going to develop emotions, where the child is going to maintain a contact with the external world, and a lot of faculties are going to establish these things. So in short, it's a very critical period. It is the period where the basic foundation of the brain is going to form. So that's why it makes it very important.
That's fascinating, and especially for you and me. I know you have a 4 month old baby at home, and I have a my youngest
14
is
months.
and my youngest is about 7 months old. So they're both
Yeah.
in that age that you were just
Oh,
talking about, where they're learning to. Yours probably is walking now, and mine is trying to crawl and trying to start making some eye contact with people around them. So it's fascinating
it's so
to
fascinating. Yeah,
yeah, to
especially,
see how things change over the
yeah,
course of like days and weeks. It's really a miracle.
yeah.
So, what are some of the critical periods in brain development? And is it true that babies are like sponges and they're really absorbing everything from the environment? That's coming out of the just the first 5 years, like first 7 years, 10 years, 14 years. What are some of the critical periods of brain development?
So the critical thing, like when the child is, it's a very good question. So when a child is born, you will often notice that first is vision. Important thing is to look for if your child is tracking your movement, and they cannot see things from far away. Vision is one of the important things which they develop. Usually from the birth period to 6 months of age is quite important for this. And why, like how it is important. For example, the child has two eyes and both eyes have a connection to the cortex. Eye is just a camera. The actual vision does not lie in the eye. It
Mm.
is just a receptive organ. The
Yeah.
vision actually lies in the cerebral cortex at the back of the brain. If eyes are misaligned, one of the eye is lazy, what's going to happen, which means that one eye is not, one is like this, the other one is like this or whatever direction. So the eye which is giving a correct signal to the brain will receive the signal from the correct eye, and from the abnormal eye, brain will just abort that signal. So
Mm.
if you do not fix that period, that eye early enough, then the brain will not learn anything from that abnormal eye, and a condition called amblyopia will develop.
Mm.
Same thing for hearing. So hearing, the ears are just a microphone. Just like in the start of our microphones were not working, so it is just a microphone. And then our brain, we have a special area in our brain, we call it, it's in the superior portion of the temporal lobe, the hasal gyrus. So that's where the actual auditory receptors are there. So for example, if the ear doesn't work, then your hearing might, you may not develop hearing. So same is the language. So in order for child to develop a language, a child has to hear something.
Yeah.
He will hear, our receptive areas in the brain will work, and then a child will start producing language, because there is a special area in the brain which is dedicated for the reception. We call
Mm.
them Wernicke area. There is a special area in the brain which is specialized in producing the language. We call it Broca area. And then the other thing, we have a very special type of structure in the brain which deals with the emotions and attachments. So especially the mesial part of the temporal lobe, that is the major area. How the child is going to communicate, how the parents are going to communicate with the child, and how the needs of the child are getting fulfilled by the society or by the environment around the baby, that also leaves an impact on the baby. So that's what makes everything so critical. And the babies are like sponges in a way that they have amazing reception. So a lot is happening in the brain, as I just said, answered in the first question. So they have lot of room to absorb things compared
Mm.
to us, where the faculties are already built. So most of the, which, for example, what we give to kids, they retain. Compared to us, we just retain very little, and the
Mm.
majority we just forget.
So they're absorbing most of the stuff from the environment, even if we
Yeah.
don't realize what they're doing. So
Mhm.
Broca's areas in Punjabi comes a Brokwas area. Like we do a lot of Brokwas from that area, like one of the
Yeah.
nerdy jokes. I know, sorry about that.
Uh-huh.
So what you may have partially answered this question, but for the parents who have kids in the growing age and the developing age, what are some of the things they can do daily that can have the biggest positive impact on brain development?
Again, Ahmed, you're asking very good questions. First thing, be a very good observer
Mm.
and respond to your kids' needs. So if a child needs something, I don't think we should wait, because if we let him cry, then the child is going to learn that nobody listens to me in this house. So respond to them, talk to them, fulfill their needs. And then the other thing, the child needs tender, loving care. They need hugging, they need cuddling, and then we need to look into their eyes, and then play with them. If they are in the age of reading, read with them every day. It
Mm.
creates a very positive bonding between parents and the kids. And nutrition is very important, because
Mm.
eventually the brain is a matter. It
Mm.
is made of some substance, and you need proper nutrition to build the brain. And then the adults have to let child explore things. So if he wants to eat and he just put everything on his face, let him do it. So if he
Mm.
creates a mess, that's okay, fine. He's learning. And then if he's taking time in doing things, so as a parent, sometimes it's hard, but That's what child needs.
Give them the time to do whatever,
Yeah.
because we usually jump in, let me fix it, and
Yeah.
don't waste time. We have to go somewhere and we have to be somewhere.
Yeah.
So yeah, give them time to do things at their own pace. Huh? So you mentioned nutrition. So of course, nutrition plays a very important role. But are there any special foods or vitamins or any kind of supplements or any daily things that people should use as far as the nutrition is concerned to help the baby grow better neuronal synapses and build better connections in the brain?
Thank you for asking this question. And you have already answered a part of it, which is basically what is our brain made
Hmm.
of? It is made of neuron. And what is neuron made of? Neuron is a protein, and then there is a lipid in it, so it's a fat. And then we have neurotransmitters. These are basically special chemicals which transmit from one neuron, jump from one neuron to another neuron. And what are they made of? They are made of amino acids, so proteins. And then we have certain hormones in the body. For example, the thyroid hormone, it's
Mm,
important. What is it made of? Iodine. And
mm,
then you need acetylcholine, which is the neurotransmitter, and it is very important for memory. And what is it made of? It is also a kind of a protein which comes from eggs, yolk, breast milk, meat, soybeans. The substances which are very important, just imagine. So for lipids, omega-3 fatty acids are very important, which is present in milk, and it is present in walnuts. But we're not going to give walnut to a very little baby. For example, iron is important in hemoglobin, which is
mm.
the cell in our red blood cells have a substance oxygen carrying.
Yeah.
And what is it made of? It's iron.
Yeah.
And around the iron it just catches oxygen,
Mhm,
like it has four pockets where it catches oxygen. So iron is important. Iron is present in lentils, spinach. Zinc is present in meats, eggs. And then vitamins are important, which are present in green leafy vegetables and some fruits. Sunlight is very important for babies. We
mm.
often take sunlight as a nutrition. Why? Because it has vitamin D in it, and vitamin D is very important for the regulation of our growth and also regulation of our mood pathways. So not only plants do photosynthesis, we also do photosynthesis.
That's true. So once they start eating solid foods, try to give them a little bit of everything. But do they also need, if a kid is eating everything, they eat some meat, they eat some vegetables, they eat some proteins, carbohydrates, they eat some fatty food. Do you also need to supplement them with, for example, omega-3 or lecithin and things that produce choline on top of the regular milk and eggs and all that stuff that they're using?
I don't think that is needed because our regular food has plenty of supply to fill the needs, unless your child need a special thing. And one
Mm.
thing I want to tell you that which structure of the brain is made of carbohydrate? Nothing.
Yeah. Need glucose for brain's energy.
Yeah, so that's
Yeah.
the point. So glucose is needed in a small amount to fulfill the needs of energy. So if we give excessive glucose, what it's going to do? It's going to convert into unhealthy fat, and it will just create problems. So here is the catch. I am also culprit of it. My family, the kids, we go out eat. We eat biryani,
Yeah.
and they eat fries, ketchup, and Coke, chicken nuggets.
And then we make them finish their bread too. If you have one roti, you have to finish it, and you have to finish your plate of rice. Otherwise, you can't do this or
Yeah.
that.
And the other thing, I think this is where we also went wrong when we were little. I don't want my kids to eat too much bread because there is not much in the bread. Bread is just sugar, and we have to develop this habit early on if we want to avoid later problems, because we human beings are basically we run by habits.
Yeah,
We hardly think whatever when we do something. We just go
yeah,
whatever is in our brain, pre-feeding, whatever is written in the script, we just go for it. So I want to give our audience this message that just understand the broader aspect of food and not the simple bread and sugars
yeah.
that we have to cut on. We will
As
talk about it.
Pakistanis, it's hard because my wife and I were thinking of weight loss and things like that, and
Yeah.
everyone tells you reduce bread, reduce rice, and I said, what else can we eat? What is it that we can eat without rice and without bread? And we couldn't think of a lot of options. So
Hmm.
the way we have been raised and we've been fed as a kid, it's hard to get rid of those old habits.
Yeah.
So one very popular questions, jumping from the nutrition to the brain development, the negative exposure to the brain development. A lot of questions these days about the screen time. And there's always this question, is there a safe screen time? Is completely harmful? We do need the parents need the screen time for their sanity. We kids don't need it, but we need it because we can't be
Yeah.
with them 24/7 and living in US, raising kids by yourself without though it's always
Yeah.
hard. So we always
Yeah.
need a break, give them an hour, 2 hours of screen time. Is
Mm.
there a safe screen time? And if there is a safe screen time, what do you recommend? What do you do for your kids? Watching TV is okay, PlayStation, iPad, just listening to some music on what can we do?
Emma, this is an excellent question. And I really like your point that even when we want to relax, our relaxation is watching either YouTube, Facebook, or watching TV. Even my wife get mad. I haven't even seen my drama yet today. You know how busy I
You need
am?
a daily dose of
I'm very busy. so, so about screen, I think this is also a generational shift. So just because when we were little, there were no tablets, there were no cell phones, it doesn't mean they are bad. So since we then because we all of a sudden we start comparing our kids with ourselves that you are so bad, you watch iPad all the time. Look at
yeah.
me. When I was little, I never watched iPad because they did not exist back then.
Our parents
So,
couldn't probably afford it either.
yeah.
Yeah, we hardly
So
bought a bike at 12, 10 years old.
that's true.
Yeah.
So it is not inherently bad, what I think. So
Hmm.
it's just like excess of everything is bad. And as a parent, if you keep a very good control on the content on the screen, then I think it should be fine. The other thing, do not associate the mistake which we do as an adult. Sometimes we associate it with food. There are some kids who just say they need a iPad in front of them when they eat. So what's the bad aspect of that? As a result, there is no family dinner time anymore. There is no family
Yeah.
breakfast time anymore because we all are pretty busy. And one of the bonding factors which bring families together
Yeah.
is the food. I remember my grandmother, she was a source of union between the all family members. And what was her specialty? She would cook food and then she would call all of us and all of us would come on a dining table and we would eat together. And that's how our family developed. So this habit I would like, if you, as a parent, if you can somehow take that away from kids. The other thing, some of the content on tablets is really good, it's
Hmm.
really helpful, but what kind of content is bad, what I feel like, for example, if they are getting too much stimulation. So imagine they are watching something and the picture keeps on changing very fast. So that's going to affect their attention and that's going to affect the retention of the memory. So
Hmm.
it is very much like a, for example, when some teacher gives you a lecture, there is a teacher who is giving you a lecture on a board, on a whiteboard or a blackboard, versus somebody is running a PowerPoint slides in front of you. What do you like? I personally like the whiteboard better because it
Yeah.
has more retention. At the end of the day, the take home message is like you retain more stuff compared to like
Changing slides. Yeah.
changing
Yeah.
slides. So that is aspect. If you give them too much of tablets, so their memory is gonna get affected. I don't want parents to be too strict that you just don't need to look at iPad at all. In the early stages of their life, around maybe 15, 16 months of age, let them, for example, if they want to talk to grandparents, let them talk.
Yeah.
They want to talk to the uncles, let them talk, let them watch them. That's a helpful thing. And keep an eye on them. So as long as they watch it like for half an hour a day, I don't think it's bad.
So, do we have any research at this point to say, like, all these some because to hear these things and they may or may not be true, that of course there's a lot of like radiation and the Bluetooth and all like internet rays, and there's a lot of like shui around you. You know? So there's a lot of like waves going on around you. So, is there any research as of today to tell us whether it's good or bad, or we don't have any kind of answers in that area?
Actually, the radiation from the screen, I'm not like familiar with this kind of research at this time. I will look into it. I think
Mm,
that the impact is more of a psychological nature,
mm,
because these tablets are pretty much like, they are the child get hypnotized,
yeah,
and then he
yeah,
loses contact with the surroundings.
with the real world.
So yes, you know what, and the tablets are, they're so engraved. So I do pediatric neurology, right? Okay.
Mm.
So the common trend which I see in my clinic, the moment I enter the room,
Mm.
the child is watching the tablet and the mother is coloring the book.
It should
It's,
be the opposite.
yeah. And if I notice that whenever I enter the room, if I notice that the child is not on a tablet, so I think there's something serious going on.
They're
So
not
it's,
able to
yeah,
keep
but
up with it.
yeah, but I do feel that we are to the point we will have to seriously think about it, because it releases a lot of dopamine in the child, and it's like very easy gratification. Limiting it, but we gotta limit it very wisely.
Mm,
And that limitation of screen time mean more parental time, because parents will have to engage them somewhere
yeah,
else.
yeah,
So only then you have to provide something which gives them more dopamine compared
yeah,
to the screen time. Only then they're gonna stop using it.
yeah. Thanks for explaining that. So, moving on to the next question. Growing up in a stressful environment, how does that affect child's brain in the long term? Like kids from broken families or families where parents are always arguing, or there's some kind of financial stress or environmental stress.
It's a very good question, Ahmed. Stress, first, like just imagine, first of all, what does stress do to you? There is a special pathway in our brain, and we have a structure in our brain, we call it hypothalamus, which is right in the center of the brain. We have that structure. And then
Mm,
we have a structure called pituitary gland, which is also called Adam's apple. And that hypothalamus pituitary, it is linked with another structure in the field of nephrology, right above the kidney. And then we have the adrenal glands. So that's how the nephrology and neurology
yeah.
connection. So from where basically the stress hormone, the cortisol, is released. So what does it does to you? If it released too much, it's going to increase your blood glucose, it's going to increase the blood pressure, it's going to affect your immune system, and then it's going to shrink many regions of the brain.
Mm,
Okay, for example, it's going to shrink a structure called hippocampus, which is the area where the memory is stored. Because
mm,
what is the stress? Chronic stress, one is an acute stress, like you need a little bit of stress, that's fine. But if the child is like growing up in a very stressful environment, like a very long term stress, that will the child personality will be effective, and their needs will not be fulfilled. That's because the stress is very much like it is like fight and or flight response. It basically prepares you to deal with emergencies. So baby feels like there is emergency 24/7. So
mm,
in order to deal with emergency, then the child is the only like the areas which are really essential for life, only they will progress. And all
mm,
the areas which are needed for future, right, so they will not develop very well. So that is why we see that the kids who deal with stress early on, so they end up getting conditions like attention deficit hyperactivity. They cannot focus well in life. They develop learning difficulties. They cannot trust anybody,
mm,
because when they are under stress, there is a special area in the brain which is called amygdala. It is in the temporal lobe. It is a structure in the brain. It's a special nucleus which deals with the fear. So its function will be enhanced. So the child will be in a phase of hypervigilance all the times. For example, have you seen the kids who come from the war zone? I just heard the story of a child who came from a war zone, and even the sound of a helicopter, he'd start tachycardia and he would go into panic phase. He would
mm.
think as if the helicopter is gonna drop something on
Yeah.
him. So, so
Yeah,
that is
thanks
why
for explaining that. Yeah, we hear a lot like stress affects you, but I've never heard the details like you explained, like which parts of the brain are affected and how they affect the kid's future. So thank you very much
And I
for
wanna
the
I wanna tell
explanation.
you one
Yeah.
more thing, Amit, on
Yeah.
this thing. So It is just like an example which I learned by my own. If I ask you a question, if you want to float on water on a swimming pool, what do you need to do?
Just let it go, let your body go and
Relax. In order
relax.
to float on the water surface, you need to relax. So,
Yeah.
what will happen if you make your body stiff while you're floating?
Yeah, you start sinking.
You will sink, right?
Yeah.
The swimming actually is nothing more than moving your body while your body is relaxed. Okay. So, what we learn from it, in order to be successful in life, basically, we need to learn how to work while staying relaxed. Only then you're gonna move forward. Because if you
Mm.
try to do something while you're stressed, all your effort will convert into heat. The outcome will be zero. You will be studying all day, but you will still fail in the exam because you will not be able to perform. So that is why this is another aspect how to deal with stress, which is very important for parents to teach their kids, because whatever efforts they do on their child, if they do not equip their kids to how to perform under stressful situation, they're not going to get the result.
I know I'm diverting a little bit from our topic and we have a lot of other questions left, but
Yes.
just briefly on this subject of how to tell the kids to relax. Do you have any quick tips on this? Because we tell the kids to relax, it's okay, it will be fine. It's easier said than done. We've been through that situation where you're going for USMLEs or going for a visa interview or something big is at stake and you want to relax, but you cannot. So, is there any neurological tips or it's all like meditation and yoga and things like that?
Actually, the root cause of the stress is usually the fear, and fear is basically hypothetical. It basically does not exist, but this is something we just create on our own.
Yeah.
So one of the ways I often tell to my patients how to overcome these fears, and if somebody cannot overcome their fears in life, it is very hard for them to grow. Okay, another example, everyday life example. So if you want to raise a plant, what do you need?
Yeah, you gives it some sunlight, give it some water, put it in open space. So
Okay, what
I'm not a plant person, but my
but
wife can
then what?
probably answer that question better.
You prepare an area of soil,
Hmm.
and now you put a seed,
Yeah.
and you're providing sunlight, you're
Hmm.
providing water. What else?
I don't know, relax the plant.
Okay,
Staying on the
considering
subject,
you
hem a little bit.
okay, you're giving a kiss to your plant every day. It's saying that I love you a lot.
Yeah.
Okay, what else? What else you're missing here? Which is very important for your plant to, you want the required fruit.
The nutrition, of
Okay, you
course.
gave the nutrition, you put like a lot of fertilizer, then what? Still you're not getting the
Like a
required result.
safe environment.
You know
A
what you
safe
need,
environment.
what you're missing? There is something called de-weeding.
Oh,
So
yeah.
if you have a fertile area which is full of nutrition, all the weeds, they're
Yeah.
basically gonna come and they're gonna take your potential, the potential of the plant away from it. And what are the weeds of our brain? These are the
The
fears. What are
fears.
the
Yeah.
fears? Fear of failure,
Yeah.
fear of humiliation, fear of getting sick, fear of becoming poor, fear of losing the loved one.
Mm.
So, because each of us, when God sent us to this world, we come here with a very special type of talent,
Mm.
which is a gift of the nature which is given to us. And why many people cannot achieve their personal legend, whatever they are supposed to do in life, why they cannot do it? One of the major reason is these fears, because their potential, their attention, their focus is
Mm.
consumed by those fears, and then they cannot
Yeah.
achieve what they want to.
So, what
I
do you tell your patients to help them achieve that?
I literally talk to them. I
Mm.
listen to them. It's every but you really have to make a connection to your patient and
Mm.
find out what are their fears, what kind of questions they have. But if you find those, you try to solve those questions.
It's more along the lines of cognitive behavioral therapy. Like you can teach them to do it on your own, or you can probably teach their parents to talk to them and walk them through their fears and maybe address some of them.
Like parents, actually, one of the things which I have noticed in our general practice, which we are ignoring a lot, is family therapy. Because the
Yeah.
problem lies within the whole family. It's not the child. Child is just the one who comes to your clinic, the representative sample. But the problem is in the father, the mother, plus the siblings. So you have to take them as a whole. Have you noticed something? If you go to a restaurant, the obesity you will find in the whole family, because it tells you that their whole family food habits are bad.
Yeah.
So
Yeah, that reminds me of a joke. You may have heard about it when they said, does obesity run in your family? I said, no one runs in our family. All right. Thank you for explaining that. Moving on, how about sleep for kids' brain development? And how much sleep do kids need? I know different ages have different requirements, but let's talk about our kids. So the ones that are in within the first 2, 3 years of their life, and then when they get to the 11, 12, 13 years of age, how much
Mhm.
sleep do they need to keep their brain growing at an optimum rate?
Okay, beautiful question. Ahmed, we are lucky that we have little kids, and we have, I think the kids have taught me a lot. These medical books did not teach me what my kids have taught me. So when your kids are sleepy at night, what happens?
We feel so blessed that they're sleepy and they're going to
No,
bed, and
no,
we
no. What
start making our
happens?
own plans.
No, what are the signs? We that because
What
they go
happens to
cranky,
them?
they become fixated
Yeah.
on things. They Your child might tell you at 9 p.m. that they want to go to the park, and you say, "Oh, it's dark. No, I want to go to the park." And
Start throwing
if
tantrums.
see, and this is and those same child who is so aggressive, who is not listening to you, when the child goes to sleep and the next morning he wake up, the child is so smiley, he's laughing, he's giggling, he's so
Oh,
playful, which
yeah.
means sleep did something to the child, which changed the personality so much. So
Mm,
basically, sleep is the time where it is not the time period of recharging of the brain. And this is also one aspect. The other
mm,
thing is sleep is the time where actually the major part of the construction of the brain happens. For example, you know that whenever we learn something,
mm,
you provide me some kind of information, you tell me something. So what happened to my brain? Basically, there is a synaptic connection. One neuron just reaches to another neuron and make a connection. That connection initially is very transient. It can just break away. So
mm,
what makes that connection permanent? Sleep. It is like when you join two pieces of wood with glue.
mm,
So you need to keep them and give them time. Only then the bond is gonna be permanent. So same thing, that's what sleep does to your brain. And all the neurotransmitters, basically they are, all the requirements are met during sleep. And sleep is the time when the child also, for example, all the emotional content, so the self analysis, like
mm,
what things he can do, what he cannot do, those concepts also get cleared during the process of sleep. And sleep is the time, I think, which is one of the most important time. And the other thing, the sleep timing changes with age. So when you have a newborn sleeps around 14 to 17 hours per day, the infant sleeps around 12 to 15 hours, toddler sleeps 11 to 14 hours,
mm.
and then preschool, and then they sleep around 10 to 13. And our teenagers, even they need 8 to 10 hours of sleep, and that also
Mm.
includes nap.
Okay, yeah. So,
Another point, sleep is not only important for kids, but as a parent, it is also very important for you. So one thing I started doing whenever I was very busy in the hospital, I would go home after working nonstop for like 12, 13 hours. I would go home, and by the time I would enter, I would be so tired, and it would reflect on my face. And I noticed that my kids would go into stress because I was the culprit. I was giving them the stress because it was so
that,
visible on my face. Yes. So what I started doing, I started taking small naps. For example, if I get a break from work, I will just go to the car and I would take 15-minute nap. Before entering my home, I would just lay in my car for 10 minutes, just
mm,
15-minute nap. I noticed that I would enter the home and my kids would look at me with a fresh face, and the overall the environment of the home improved
yeah.
significantly.
Yeah. I'm glad you mentioned when you took the naps because I was assuming like you were taking the naps when patient was giving the history.
And please
Okay,
don't
yeah.
take naps while you're driving, okay?
While you're driving for sure. Yeah, definitely. How does language exposure early on change how the brain is wired? And especially kids who are parents of Pakistani parents or Korean, Chinese, who are speaking two languages. They're getting exposed to Urdu, Hindi, Chinese, as well as they're getting exposed to English language at home. Does that help or does that hurt the
It's
brain
very
development, getting exposed to multiple languages?
beautiful. It's very helpful. You just understand one thing, that each language, like Urdu, Hindi, Chinese, Vietnamese, Japanese, Portuguese, English, it stores at a different region of the brain. For example, there are certain faculties which you develop at a specific age. Knowing different languages mean, for example, water, you will know many names of water, right?
Mm-hmm.
Each thing will develop a connection. Imagine something. I lived with a German lady when I was in Buffalo, like 8 years of my life. German was her mother language. And then when she was 80s, she started developing dementia and she also started developing some hearing issue. One day, a guy came who knew German. A different personality came out. And another thing, we had a Turkish resident with us whose uncle got a stroke. He knew three languages: Turkish, Persian, and some local Singali language. When he got stroke, he lost two languages, but was able to communicate 15 days with only one language. The other languages came back. Knowing more languages makes you smart, so the exposure is very important.
Okay,
But you got to be very good in one because you also have to live in the environment.
yeah, because sometimes you worry if you're confusing the kid with speaking a different language at home and then getting exposed to a different language at school. So it's actually helpful than hurtful. Now, talking about parents who are always worried, especially in an environment where we're living in right now, everyone wants their kids to excel. And they're always worried that my friend's kid or my cousin's kid is going to make it to Harvard and Yale or some of the Ivy Leagues, and my kid is probably going to lag behind. So I need to put them in Kumon and Math Genius and all kind of these brain programs. And most of these kids turn out to be very smart. But how aggressive you need to be with all these enrichment programs, Genius Baby programs? At what point do you say it's too much and it's probably going to hurt the kid, then help them? Do you just let them go to school and do what they're doing in school, or do you have to keep piling up more stuff on top of it to make their brain develop new synapses?
Very good question. And as a pediatric neurologist, I thought a lot about it. Memorization does not mean that the child also has deeper understanding of the
Hmm.
subject, or it does not mean the child also has flexible thinking. So just someone's child knows the names of the shapes and the letters early, it doesn't mean that the child is be a creative genius, because what we want our childs to be in future, problem solver, and we want them to be creative, because creativity is what separates us from the other animals. We can
Yeah.
find ways of doing things, we can do one thing in so many different ways, and that's only happen if you have some kind of analytical thinking. And that thinking will come if you give your children ample time to explore things, let them look at things their way. That is why I like Montessori's a little bit better than other systems, because the concepts of the Montessori's let kids explore whatever they want to. They just observe the kids. They don't provide too many interruptions and they don't want too much of a structured environment. So the
Mm.
child has a chance to basically grow on their own. These flashcards or interactive stuff can be good, but it is not replacement parenting. So basically, I think this is, since we are doctors, we are too busy, and
Mm.
sometimes we don't give our kids such time, and we think as if just I will buy them a flashcard and I will buy them a Genius Baby program. Okay, okay, I'm buying you a Genius Baby program, and I want you to become like very successful in life. I don't think that's gonna replace 100%. It may provide a little bit of help. And another thing, Ahmed, I have noticed that we should not buy too many toys to our kids, because what happens then, there is no creativity. Whatever they want, they get it, because they don't want clutter. They need
Mm.
emptiness. They need, for example, if they want something, we would really like our kids to think about it, think about the ways how they can do it. So have you noticed all the geniuses of the world, they came from parents who were not able to provide everything to them.
Yeah.
So what happened, these kids basically from the early on, they learned that in order, if they really want something, they have to basically,
Be creative.
yeah, be creative.
Yeah, exactly. And that basically answers my next question that I was going to ask, how relationships and attachment to the caregivers affect the child's brain. So you already answered that question, that more than the toys and the flashcards and everything else, it's the care and the time and the attention of the parents and the caregivers that will affect their brain development. So, moving on to the next topic that's very close to my heart. We have a lot of questions for you, but due to limited time, I guess we'll have to skip some of them. But these are some of the important questions that I wanted you to answer for parents who are dealing with kids who have developmental delays or some kind of neurodegenerative disorders. They might want to know the answers to these questions. The first question is, which children are at highest risk for neurodevelopmental disorders? And how early can we spot the red flags?
Very good question, Ahmed. For example, the normal age of when the child comes into this world is 40 weeks. If a child comes early, the development which happens inside the mother is very fast, is very appropriate. But when the child comes early, those kids are under risk. So they can get sick, they can get infection, they can get developmental delays. And the kids who get some kind of issue at the time of delivery, whether they get less oxygen or they get some kind of trauma at the time of birth, these are the kids you got to take care, like they are at risk. And then the mother's health is very important. How did the pregnancy go? The If mother had gestational diabetes, if she had hypertension during pregnancy which was uncontrolled, that affects the baby. If the mother was taking some kind of medications which are not helpful for the baby, those are at risk. If mother takes some kind of drugs, they affect the baby. Some kind of infections, they can also affect the baby. And then there are certain things, for example, you can't control. For example, the kids have some kind of chromosomal issue, some kind of genetic issue. So it just happened by chance. But those are the kids need a little bit more care, they need more attention. And then when your child is growing, I want you to understand this very basic concept. We human beings are basically scripts. There's a
Mm,
script written on a DNA which is predefined. As long as the child gets the proper nutrition, that script is going to unfold. It is already written that child is going to hold the neck at 1 month. He's going to smile at a certain age, 1 month of age. It is already that he's going to roll over by 3 4 months. He's going to sit by 6 7 months. He's going to
mm,
crawl by 9 months. He's going to stand by 1 year. So this is all the script. These are the normal milestones. All the charts are already available everywhere. The teeth are going to come at a certain time, and then they're going to babble at a certain time. So if your child not meeting those milestones in time, then seek help, because there could be some kind of deficiency and you can get help and your child may just grow normal. The other thing is, if the child is not developing socially appropriate, he's not responsive to his name, or if he's not responsive to emotions, so that's also a sign that there is some kind of concern. You have to make sure that whether is he able to hear okay. There may
mm,
not be, there could be some issue. There could be just simple thing, simple, or like maybe the fluid in the in middle ear. You fix that fluid and he will be able to hear well and he will be like a normal child. And there
mm,
could be vision issue,
mm,
so you just provide glasses at a proper time and the child will grow normally. And then you are a mother. We doctors may be the specialist of our field, but you are the specialist of your child. You dad, you are the specialist of your baby. If
mhm,
you feel that your child is lacking something, don't ignore it. Speak
mm,
up, talk to your doctor, because lot of resources, lot of help is available and we can do. The other thing which is very important, that if your child has low tone hypotonia, so
mhm,
that's also a sign that your child need a little bit more attention. So another thing, your child achieves a milestone. He already learned how to walk, and now your child does not walk anymore. Your child started speaking by 2 3 years of age, and now your child does not speak anymore. Instead of progressing, your child is now regressing. If you see that kind of thing, please immediately seek neurological help. Come to us. We can't promise, but there are many conditions which can be reversed and we can help.
Thank you for explaining that. So, besides the things that you mentioned, controlling the blood pressure and blood sugar for the mother and avoiding things that may hurt the baby, are there any other ways to reduce the risk of developmental delays before birth or in early infancy? Because I've seen a lot of parents, when they don't find answers, they start looking for things to blame, like immune vaccinations, or now we hear a lot about Tylenol and things. We're just basically catching at straws to see what might have happened. Why did this happen to me? And anything that preceded that event is blamed, whether it's a benign or harmless thing. So, what are some of the things which can be done practically to avoid these problems?
It's a very broad question, so
Mm,
I'll try to answer. The things start from pregnancy. When did mother find out she was pregnant? Very important. Then, if mother took prenatal vitamins, if mother went to the doctor's visit, and if mother was under like what kind of environment mother was in, because that affects the baby. What
mm,
kind of nutrition mother was taking? I would highly advise mothers, please do not eat too much carbohydrates when you are pregnant, because what happens, that gives you gestational diabetes, and the baby become very big inside you. And when the baby become very big inside you, then the baby cannot come out,
mm,
because there are only certain pounds of a size of a baby can come out safely.
mm,
Your target needs to be, you do not want your baby more than 7 8 pounds, and that has a direct link with how much glucose you're going to take. So then the other thing, the process of delivery is very important. If mother gets, for example, fever at the
mm,
time of delivery, it's very scary and for the baby. And how does the delivery process happen? For example, if baby gets free fetal bradycardia, which means normally at the time of delivery. So you notice that in the labor, they put the OBGYN, they put the baby monitor on your belly. And that baby monitor starts telling you about the heart rate of the baby. Each time you get contraction, baby heart rate go up. So that's a normal response. If, for example, during this time, instead of baby's heart rate going up, baby heart rate starts going down, it's a very scary thing. The delay in C-section in those situations can be very, very
yeah,
traumatic, because it may lead to hypoxic damage to the brain, and then it leads to permanent disability. So that factor is important. And then the other thing is about the nutrition of a child, because it is very important for brain growth. Then there are certain kids who have some underlying
mhm,
genetic condition. So don't compare those kids with regular kids, because these kids need a little bit more time compared to the other kids, and they have their own special needs. The best is to learn about them, because their growth chart will be a little bit different from the regular growth chart. So please don't get worried too much. Just as long as those kids follow that growth parameter, growth chart, it's fine.
perfect. And do you have any special advice besides what you already talked about for parents of kids who have Down or trisomy 21 or any other genetic syndromes in that category?
Oh, that's a good question. So kids who have some kind of genetic condition, and Down syndrome is one of them, you got to start early, because your intervention as a parent can increase their education level by 2 years.
Mm,
They may need little bit more bonding. They may need little bit more talk. You need to read for them, talk to them, respond to their needs, and respond to their curiosities. And they may take their little bit more time, but that's totally fine. One thing I remember when I was little, one time I went to one of the family friends. So when I was little, I was not a very good student, because I was not into education too much, like getting scores and stuff. I never cared early
okay.
on in my life. So when I started getting interested in education and getting grades, initially I was not getting, despite hard work, I was not getting good grades. One day I went to one of the that uncle. So he told me that you don't have very good background of education. It's fine, no problem. If a genius guy needs 2 hours, you spend 8 hours. You will be equal. And over time, if you keep doing it, things will improve. And then at the end of the day, there will be no difference between you and a genius guy. So I think what is important for if you have child who has a little bit of developmental delays if you put this virtue of hard work in them, then they will compensate. They may
Yeah.
not achieve like you don't need to with the regular kids, but they will achieve a lot. I
Mm.
see here in US everywhere, even the Down syndrome, they are working in grocery shops. They are doing jobs not like they're not flying airplanes, but still they function and they can
Yeah.
live an independent life.
Yeah.
And as a
And
parent, please don't give up. That's the whole point.
yeah.
So
Yeah.
if you work hard, they will do pretty okay.
Good.
Hmm.
And talk a little bit more about early intervention because a lot of people think it's all genetic. What's the role of early intervention, physical therapy, speech therapy, occupational therapy, and how does it make a lifelong difference for children with the neurological challenges?
So early intervention mean, as the name says, it says that you start early. And the whole science behind it and the philosophy behind it is that our brain is very plastic.
Mm,
It is still immature and it can adjust. So I give you one example. In a right-handed person, the speech is located on the left side of the brain. In the left side person, speech is located mostly 70% on the right side. What if you have a baby who gets stroke on one side, left side, for example? Happen to speech? If, for example, a stroke happened at the time of birth, a birth-related injury? Does it mean the will never speak? No, child will speak
mm,
because because all the faculties and the milestones which the child achieves at a specific age, that function will move to another area of the brain. So, for example, if the left side of the brain where speech was supposed to develop, if that area gets damaged, the faculty, because the DNA of the baby is the script is correct. The
mm,
script that this, because in the script, nature has written that this child will have speech. Okay. So then it will just move to another area. So that's the concept. So if the child has some kind of insult to the brain, as a result child would get cerebral palsy. Cerebral palsy mean like they will have motor weakness at certain region. But if you start exercises early,
mm,
then they will get better. So they will not get that clumsy. They may
mm.
not like 100% better, but pretty good.
Functional. Yeah.
Functional. So the therapies which are currently available, one is the physical therapy, which focuses on the gross motor strength and balance. The other one is the occupational therapy, which focuses on the dexterity, handwriting, fine motors. And then we have the speech and language therapy, which deals with the speech and pronunciation. And then we have the behavioral therapy, which deals with how the child interacts with society. And then we also have something called the family therapy, which
Yeah.
we mentioned earlier, that because that looks at the whole family
Mm,
and then they guide like where as a family you are doing, you can improve.
yeah. Excellent. Let me ask you one last question for this session, and then we will move on to the next session and discuss your favorite subject and the area of your expertise where you've been spending most of your time for the last decade or so. Do you see parents doing some things that they're doing with good intentions, but they may unintentionally or unknowingly be harming the kid? What are some of the common mistakes parents making, not just for kids with special needs, but generally for the kids, especially in this day and age, which you wish they were not doing, and that would give the kid a better chance at growing a better brain or neurological development?
So, Ahmed, very good and excellent question. This question is about overdosing, right? So the overdosing happens in certain things. For example, we may be the culprit of it too. For example, you're too busy as a parent and you just provide them resources but not the real interaction, or you have not controlled the home environment and you're talking to the child and there is a lot of background noise, TV is on, tablet is on at a full speed, and
Mm,
nobody can listen. Or the example of the child eating while using a tablet, so that you can't even talk to them anymore.
mm,
So some parents, I call them helicopter parents, they are on top of kids all the times, so they don't let them do anything on their own. Like for example, your child make a mistake and you immediately fix it. You don't need to. There are some stresses which the child needs. Until they fall from a bicycle, they are not going to learn how to ride a
Mm,
bicycle. This is a kind of a regular normal stress. It's fine. For example,
mm,
the other thing, if they are failing, let them fail. Failure is
mm.
very important in life, because if you won't fail, how would you analyze what mistake I did, and then you will retry, and then you will fail again, then you will retry, then you will fail again, and then you will realize, oh fine, yeah, you know what, that's the mistake I was doing. So no need to like helping them all the times. Okay, the other thing I think we as a parent do, and even I made that mistake. For example, your child does something, and you have to mirror their emotion. For example, your child did something wrong, and the child started crying, and you as a parent found it very funny, and you say, ha, child is going to take it very negative. We say
Yeah.
you are, although you really want to, you felt it so funny, but no, don't laugh, don't
Yeah.
laugh. If they are sad at that moment, make a sad face. And
Mm,
because that's gonna, the child is gonna learn empathy. So if they are very happy on something, be a part of it. And the other thing is yelling at the child. You are very tired, and now you are just constantly yelling at them, even on a minor mistake. As I discussed before, you as a parent, you are very tired, and the child very receptive. They are sponges. If you are tired, if you are anxious, if you are disturbed internally,
mm,
they're gonna take it.
mm.
You know what, the other thing, the parents make a mistake. I've noticed that when you are in the airplane,
Mm.
they teach you at the time of emergencies, when the oxygen mask drops, they tell us to put oxygen mask on yourself first, then help the other.
Yeah.
So as a parent, I like this habit of my mother too. So she would wake up in the morning and would have her breakfast first. So that way, when we would wake up, she will be busy helping us, and then things would be fine. And some parents do, they say, I'm a very good parent, I'm not going to eat myself, I'm going to not fulfill my
Ye-
physical needs.
Mm.
Eventually you're going to break up.
Yeah. At
Your
the wrong
glucose
time.
source will be over, and then you're just going to collapse.
Yeah.
So it is important to take care of yourself, take care of your sleep, take care of your health as a parent, and then
Yeah.
you
Yeah.
will do
Well,
well with.
that's amazing advice. And we're going to close this session. So, people who stayed with us this long, you were learning neurology and brain development from one of the top experts in the world. I don't think there are a lot of people in this world who know about kids' brains and how it works and what can go wrong with it than the person sitting right in front of you, Dr. Naeem Mahfooz. So, thank you very much for sharing your knowledge and expertise and explaining things in so much detail. I learned a lot from this session. We'll let you take a little break, and we're going to meet up again for our second session where we'll be discussing seizures in kids, how they can present, how they can be missed, and what can be done about the seizures from the world expert in epileptology for the kids, Dr. Naeem Mahfooz. So thank you very much, Dr. Mahfooz, for now. Thank you for your time, and we'll join you again in the next session discussing epilepsy or seizures in the kids. Allah
Thank
Hafiz
you.
for now. Goodbye. Take care.
Allah.